joints of the lower limb. The joints of the lower limb are the hip joint, knee joint, tibiofibular joint, and the ankle joint, and subtalar joint. Hip joint. The hip joint is ball and socket synovial joint. The articular surfaces are the head of the femur and the acetabulum. The head of the femur is large and a large part of small ball, and it is covered with hyaline cartilage, articulating with the lunate surface of the acetabulum. The capsule of hip joint attached to the edges of acetabulum. Proximally, distally, it is attached to the intertrochanteric line and the femoral neck posteriorly. This is the head of the femur, and this is the acetabulum and the acetabular labrum, and the ligament of the head of the femur. The ligament of the hip joint are very important and divided into either intracapsular or extracapsular ligament. The intracapsular ligament is the round ligament of the head of the femur, or ligament of the head of the femur, or ligamentum teres of the head of the femur. It runs from acetabular fossa to fovea of the head of the femur. It encloses the obturator branch, small branch of the obturator artery. It is the minor source of arterial supply to the hip joint. The extracapsular ligament are very strong ligament. Anteriorly, there is the iliofemoral ligament. Arises from the anterior inferior iliac spine and bifurcate before inserting into the intertrochanteric line of the femur. It has Y-shaped appearance and prevent hyperextension of the hip joint. It is the strongest ligament of the three ligaments. The pubofemoral ligament runs between the superior pubic ramus and the intertrochanteric line of the femur. It reinforces the capsule anteriorly and inferiorly. It is triangular in shape and prevents excessive abduction and extension of the hip joint. The ischiofemoral ligament extends between the body of the ischium and the greater trochanter of the femur, reinforcing the capsule posteriorly. It has spiral fashion and prevents hyperextension and holds the femoral head in its position. These are the three important ligaments. Iliofemoral ligament anteriorly in red, the pubofemoral ligament anterior inferior is green, the ischiofemoral ligament posteriorly is in yellow. The movement of the hip joint include flexion, extension, abduction, lateral rotation, and medial rotation. The flexion is done mainly by the iliopsoas muscle, assisted by the rectus femoris and sartorius and the pectineus muscle. The extension is done mainly by the gluteus maximus, supported by a hamstring group. The abduction of the hip joint is done by the gluteus medius minimus and the tensor fasciolata, in addition to piriformis muscle. Adduction by the adductor group by adductor longus, brevis, and adductor magnus with gracilis and pectineus, the obturator externus muscle. Lateral rotation by biceps femoris, gluteus maximus, piriformis muscle, assisted by obturators gemelli and quadratus femoris. The medial rotation, anterior fiber of the gluteus medius and gluteus minimus with tensor fascia lata. These are the muscle acting upon the hip joint. This is the posterior relation of the hip joint from above downward. The gluteus medius والminimus والobturator internus, piriformis, and the obturator internus with two gemelli, quadratus femoris. These are the posterior relation of the muscle forms the posterior relation of the hip joint, in addition to the vessels and nerve posterior to the hip joint. The stability of the hip joint or stability of any joint depends on three factors: the bone, the ligament, and muscles. The bone here is the acetabulum, which is deep and accommodate the head, a large part of the head of the femur. The acetabular labrum increase the depth of the acetabulum and provide large articular surfaces and improving the stability of the joint. The ligament are the iliofemoral, pubofemoral, and the ischiofemoral. Iliofemoral anteriorly, pubofemoral anteroinferior, and the ischiofemoral posterior. And in addition to strong muscles surround the joint. The knee joint is a hinge synovial joint between articular surfaces, two condyles of the femur, two condyles of the tibia inferiorly, and patella anterior. Here there is tibiofemoral, patellofemoral. Tibiofemoral, medial and lateral condyle of the femur articulate with tibial condyle. Patellofemoral, anterior aspect of the distal end of the femur articulate with the posterior aspect of the patella. It allows the tendon of the quadriceps femoris to be inserted directly over the knee joint, increasing efficiency of the muscle. The blood supply to the knee joint arises from 10 arteries. Genicular arteries, which arises from the popliteal artery and femoral artery. The nerve supply, according to Hilton's law, from the surrounding muscle, the femoral, tibial, and the common fibular nerves. This is the anterior aspect of the joint. The hinge joint, usually the modified hinge joint of type of knee joint, is replaced anteriorly by quadriceps tendon patella and ligamentum patelli, posteriorly